Hi, my name is Sunny Carrington-Hahn, and I'm the Director of Quality, Compliance, and Risk here at All Points North Lodge. I am filling in as a nurse at the bedside with our clients, but I'm also navigating our licensure process, our also joint commission that we'll be approaching. So overall, I'm looking at quality of our processes and our procedures, looking at how compliant we also are with everything, with medications, with fire drills, with facility and environment of care. And also the risk factor is just looking at overall risk, whether that be with clients, whether that be with protocols that we have. So it's just kind of all encompassing. Well, my background is nursing, so certainly nurses have a hand in everything regarding patients and clients. But I've been a nurse for a little bit over 10 years now. Well, I have a son, and when he was a baby, he had a UPJ obstruction in utero that we found, so we knew he had a kidney problem. And when he was 4 months old, he had a pyeloplasty on his left kidney. And so I found myself playing nurse to him, of course, when he came home. But I was super impressed by the nurses that took care of him in the pediatric ICU. They were amazing, and I just thought, I've got to actually have a degree in biology, so I had a lot of the coursework before going into nursing school, and I thought, I could do this. I just felt a calling into nursing, the cliche taking care of people, but it's certainly true. I just felt that pull into nursing. At All Points North Lodge, we look at the entire person. We look at the client. We look at their mental health, any addiction, substance abuse issues that they might have. But what we do and what makes us stand out from other behavioral health centers that are like us, the way we stand out is that we look at the entire client. So we look at the medical aspect. We want to make sure that they are healthy. Sometimes clients come to us and they haven't seen a doctor in a few years. So there's a lot of physiological aspects to their care, medication, also just disease states and conditions and comorbidities that they might have that could contribute and play a part in substance abuse and addiction, and of course mental health. So here at All Points North Lodge, we take a more holistic approach to our clients. When they arrive at APN Lodge, new clients should expect to have about a process of about an hour for intake. We will require patients to go into quarantine for either 7 days or until we have a negative COVID test result. So we try to test for COVID-19 on all of our new clients as soon as we can and get that process. So if that negative test comes back before the 7 days, then we will release those clients into the general population. But while they're in quarantine, we're looking for any signs or symptoms of this virus. We're just managing their care. Sometimes they are actually detoxing while clients are in quarantine at the same time. So it kind of works out that way, and it works out to the client's advantage and of course to All Points North Lodge. And currently we are healthy. Everyone is healthy. All of our clients are healthy. Our staff are healthy. It's truly been an amazing thing to say that. The goal of detox, and depending on the substance that is abused, I tell clients that I want to make this process as comfortable as we can. I mean, there's going to be maybe a little bit of discomfort, but we're really making sure that the patient is safe while detoxing, whether that be from alcohol, that could be narcotics, benzodiazepine. So I tell them we just want to make sure that any untoward signs or symptoms that they may experience while detoxing, we try to just negate that, and we try to just make it as smooth as possible. Of course, there's going to be a little bit of uncomfortableness and discomfort there, but the main goal is to make it as comforting as possible and get the patient through detox and get them on to their therapy sessions and their recovery period. Social detox, we do follow our ASAM criteria, and social detox is just maybe a little bit step below medical monitoring detox, which would require IV medication and continuous monitoring. Here at All Points North, we also do follow medical and vital signs continuously, or as often as we can check them. But it's just a little bit step below. These patients do not have continuous monitoring, and they do not have IV fluids, but we give them PO tapers and watch very closely for any untoward signs or symptoms that might mean that we might adjust tapers and medications. So it's just a step below, but it's certainly followed very closely as well. So at All Points North Lodge, once our patients get out of detox and they are in the general population, they're attending therapy sessions. If anything comes up medically, of course, while they stay here, usually the minimum time is around a month. It could be up to 2 months or even longer. If anything comes up, we have a partnership with our local community healthcare partners, Vail Health and CMM. And we will take clients for imaging testing if maybe they have symptoms of something neurological that we're not able to evaluate appropriately without imaging or without further diagnostic testing. So again, it's that whole patient approach here at All Points North Lodge. Patients will come to us and again, maybe they haven't seen a provider in a few years. So they detox. Of course, we're at altitude. Maybe a patient has hypertension and they haven't been followed by a provider. So we'll make sure that we take care of that. We put them on antihypertensives. If there's any signs and symptoms of abnormal thyroid, disorder, it could be just be anything. It could be orthopedic, that clients might have something that's been bothering them for a while. We try to connect the dots, and we have a very fluid continuum of care. So, they might have something that has ailed them for years, and they just haven't really managed it appropriately with a provider at home. Certainly mental health issues and addictions complicate those things, and we just kind of want to get to the bottom of whatever is ailing our clients outside of addiction, outside of mental health. We're looking at the whole body, and so we will do everything we can. Even if a patient needs surgery, we will accommodate surgery with our partners at Vail Health, the Stedman Clinic, Vail Summit Orthopedic, and a client can have an outpatient surgery, and we're happy to facilitate that and help the clients in recovery. As mentioned, we work with CMM. We also work with Stedman Clinic, Vail Health, Howard Head, which is a part of Vail Health, and of course they work very closely with the Stedman Clinic. I think I've hit all of our community partners, but Yeah, everyone knows that we're here. We have a close relationship. Some of our providers also work for Vail Health and for CMM. So we partner with them. They see what's going on in the community, and they come to All Points North and help us with our clients and follow their care here. Yeah, I would say our nursing philosophy here at All Points North is when we get new clients and when we get clients that are under our care, our main focus is to really wean clients off of any extraneous medications that they might come in with. And that could be supplements, that could be vitamins, or maybe bodybuilding type of protein shakes, and we take a look comprehensively at the client. And I think the goal is to minimize and to be a little bit more simplistic. Certainly, if we have to add medications to facilitate care, we will do that. But I think our goal is just be really strategic and make the person very healthy as minimally as we can with medications. And certainly follow all of our clients. We have such a great relationship. We see our clients all the time, even if they're out of quarantine. We see them in the general population. Things come up, they come and see us. So it's really fun to follow clients through their time with All Points North. And if anything comes up, I know that they know that we're here for them. But it's a really good nursing approach to we try to be a little hands off when they're out of quarantine and out of the high observation wing. But what's good about it is that relationship, and they know they can come to us with anything. It could just be anything. So I think that's really beneficial to our clients, knowing that in the back of their mind they have a strong nursing team that is always there to take care of them.